Health Chat is sponsored by Buell Regional Health Foundation.
May is Stroke Awareness Month, and we are here to talk about the signs and symptoms of a stroke.
And the reason why this is so important is that there are modifiable risk factors and non-modifiable risk factors associated with stroke.
Some recent statistics from the CDC report that every 40 seconds, someone in the United States has a stroke, and that every 3.5 minutes, someone unfortunately dies of a stroke. Some signs and symptoms of a stroke, we refer to an acronym, either FAST or BFAST. B stands for balance or coordination. E for eyes, any kind of blurry vision or acute blindness in one or both eyes. FAST is for face, any drooping in your face or numbness on either side. A is for arms and legs. If you have any kind of weakness or numbness on either of your arms or legs, that is a sign of a stroke. S is for speech, any kind of slurred speech or trouble expressing your words is also a sign. And then, of course, the most important thing is time. So remember to call 911 as soon as you can. Risk factors that you can change, and so those are things like hypertension, high blood pressure, diabetes. There's healthy lifestyle changes that you can make or medications that you can take for that. And then we have risk factors that aren't necessarily you're able to change. So we call those non-modifiable. And those are things like race, gender, and age. Men are typically at higher risk for stroke. Women, as we age, we get at a higher risk of stroke. So women over the age of 80 are at higher risk. Hispanics and African Americans are also at higher risk.
AFib and stroke are directly correlated. It's an irregular heartbeat that occurs in the top chamber of the heart. What happens is blood will pool and form clots in an area called the left atrial appendage. And then if the clot does form in this left atrial appendage, it can escape and then travel and ultimately cause a stroke. If you continue to have AFib for a long period of time, ongoing, it can eventually lead to heart failure.
But quick treatment of a stroke is necessary because, again, of that time factor. The first thing that you want to do is call 911, get to a primary stroke center as soon as possible. When you're in the ED, then they will triage you or assess you to see if you're eligible for a certain medication that is also time sensitive. And so those are a couple of reasons why it's important to know the signs and symptoms of a stroke and get quick intervention.
There are treatment options that Sharon Regional has just launched. It's called the Watchman device. It's indicated for patients that cannot take blood thinners for different reasons, such as if they're at an increased risk for a fall, have a history of bleeding, or at risk for bleeding, then they would be a candidate for what's called the Watchman device. It's a one-time procedure, minimally invasive. What happens is you would go up through the groin, thread the catheter up through the heart, and then deploy the Watchman device, which is about the size of a quarter. What it does is it seals over that left atrial appendage so no blood clots can form there, because that's where blood clots would form if patients have the atrial fibrillation.
So it's important to utilize healthy lifestyle behaviors, get good exercise. They recommend 20 minutes or so of exercise daily, a healthy diet with 3 to 5 servings of vegetables in your diet, as well as reducing your alcohol intake.
If you have questions or concerns about your risk factors for stroke, contact your doctor. Remember to be fast. If you think that you or someone you love may be experiencing any of the signs and symptoms of a stroke, call 911 immediately. Time matters.